Hi, Diana.
Hi, Anna.
Yeah, hi. So we are 7 people now, and I am so amazed and I am excited to have Diana here. And we have just tested our connection, and it's an amazing thing to connect two worlds of rheumatology. One is in the California and one is in Germany. And so we were considered how many kilometers are these, and yes, it's about 9,000, I think. Yes. Yeah,
Something like that.
something
But
like
we
that.
are connecting because we have the same interest.
Yeah, we have the same interest, and a couple of weeks ago we saw we have the birthday on the same day, and that was the first moment you said, hi Anna. Why is it hi Diana? We are so similar apart this 9,000 kilometers. Yes,
That's very
it's
true.
amazing. Yes. So I am excited to know, yes, what problems have your patients? Because my patient said, your doctors, you are thinking about only our medication, but we are not the medication. We are not the condition of my rheumatic disease. So what do you think about this issue?
So I have to tell you that initially, probably like every doctor or every person that gets into medicine, we are driven by science, and we want to address the tiniest thing, the tiniest molecule, and we want to be very, very specific. And practicing rheumatology, I understood that it is very important to treat the patient as a whole. Our patients are not just one molecule of inflammation. Our patients are not only one problem. And our diseases, the autoimmune diseases, they don't affect just one organ. Usually the situation is complex, and patients, they will have a lot of complaints that are not necessarily related to their joints. Because that's when people think about rheumatology, they think about, oh, you are an arthritis doctor, you are a joint doctor. And the other misconception is that you treat only elderly people, which is not true. We have a lot of young patients. But coming back to this integrative approach, I think it's very important for us as physicians to address the patient as a whole and talk to the patient about what they eat, what are their stressors, and how much exercise they do, how much they sleep. And in this way, you can understand a better situation for that patient. And you can work with the patient to address all these things besides the medication. I'm not going to downgrade the role of medication into our world, because our field made huge advances in understanding the immune system, which was probably the last that was understood, and we are far from understanding everything. But we made progress, and that progress changed the outcome of these patients. But on top of that, we have to integrate everything else.
Yes, great. And I am a very, is this holistic approach are very common in rheumatologists in the USA, or are yours very special? Because you write this thing on your website and your Instagram account. How is it
Yeah.
in
So
common?
it's not common. It's not common. I think in the last couple of years, I've met a few other people that are interested to offer this integrative approach. As you probably know, in our medical school, I did the medical school in Romania, but then I transitioned my training here. I redid all my training in the United States. There is not much education about nutrition. So we probably got exposed to concepts of nutrition for a couple of hours through the whole training that we had. And myself, I learned from my patients, I learned from my experience, and then I went to educate myself about the science of nutrition. And I actually took a course about nutrition science from Stanford to understand where is the science that backs up our choices in terms of nutrition. And on top of that, I've seen that every single patient that I had was telling me a story about a stressor in their life that actually triggered the onset of an autoimmune disease. And that made me think, how is the stress connected? We always tell the patient, stress less. But how should they stress less? What will be the mechanisms that they can use to stress less? So one of my patients actually taught me about mindfulness. And I was very intrigued because I said, what is this? What is this to affect autoimmunity or affect our brain, to affect our gut? You know, he was telling me about some concepts that were very new to me. And this was a patient that was a mathematician, so very scientifical driven patient. But he told me that he started to practice those and his disease indeed improved amazing. So I went back, you know, to PubMed, which is the biggest library for you know, medical articles, and I started to research how mindfulness can affect stress, how mindfulness can help autoimmunity. And I was surprised to see that there were people in the 1970s, actually 1979. One of the doctors that started that, he was a PhD, or he is a PhD in psychology, Dr. John Kabat-Zinn. He started a program here in the United States called Mindfulness-Based Stress Reduction course. And people all over the world are taking this course. And I went myself to take the course because, again, I wanted to see and experience and learn from people that know what they are doing.
Yeah, that's a very important point. And the crazy thing is we don't have one word in German for mindfulness. So when I speak about stress reduction to my patients, it's not that easy to transform my approach to patients, because stress reduction, what is it? Yes. And the second thing is, the first problem, we do not have a word for mindfulness in German. And the second point is, in my experience, the role of nutrition is huge, overrated in people, and the role of stress reduction is underrated. It's hopeless. Yes. And people spend a lot of money for nutrition, additional things, very huge amount of money, and the stress reduction, it's not on their agenda.
Yes. So here in the United States, there is a supplement market that is probably around $2 or $3 billion. So a lot of patients are trying to buy supplements or natural supplements to help themselves. But, you know, when you sit down and you look at the science behind those supplements, not many of them, they have a true benefit for the patients. And actually some of them could be harmful. And what I teach my patients is we have to take what is good for us from natural sources. We are connected with this nature. We are part of this nature. So whatever we eat is going to influence our body, and whatever we eat comes from nature. And when it's altered chemically, or when it's altered genetically, of course it's going to alter our body. And I also teach my patients about the importance of our gut microbiome. I'm a huge fan of that. I read a lot of studies in the last probably 3 years. Since my interest grew, I read a lot of articles about how our gut microbiome, all the trillions of bacteria that sit in our gut are connected to our immune system, how they influence our immune system, our brain. You know, I was so amazed to see that our gut influences our mood or can influence the obesity. I had no idea that, you know, our gut is the one that can driven this onset and maintain the obesity. So those were new things to me as a physician. And I try to educate my patients about all of these things, because if you don't know, you're not going to address it.
Yes, yes, you have a leg on this point, no? And a user writes now, stress reduction is hard when life throws you so many curveballs. Yes, you are right. It's not that easy, but we are the doctors. We have to point these issues. Yes. Or my patients say quite often, so I reduce my meat consumption, or yes, I'm now vegan, but nobody told me I reduce my sweets, for example.
Yes.
Yes. What about sweets and inflammation? So what did you find on this point? Sugar and this sort of.
Yes. The first thing that the patient will ask me when I start talking about nutrition, they say to me, "You're telling me so many great things that I should change about the way that I look at my plate." And the next question that I hear most of the time is, where should I start? And my answer every single time is, you should start with eliminating sweets, because sweets do create addiction. You know, sugar, it's like cocaine. When you stop eating sugar, you're gonna shake, you're gonna feel tired, extremely tired, you're gonna feel very anxious. So it's gonna take a couple of weeks until you're not gonna feel the need to eat sweets. So that's the hardest thing. Once you understand that sugar is in everything, because here in the United States and probably all over the world, we have sugar in bread, we have sugar in ham, we don't have sugar only in the canned foods.
Yeah, in cucumbers also. Yes.
We have sugar
It's crazy.
in added sugar. So what I tell patients, like, added sugar is in a lot of things. You just have to be aware where it is and try gradually. That's another thing, gradually eliminate things. So over the course of a couple of weeks to a month, you will be able to eliminate sugar.
Yes.
Sugar creates inflammation, and sugar, you know, creates diseases. Diseases like type 2 diabetes is because of too much sugar that we eat. Diseases like obesity is because of the sugar, too much sugar that we eat. So we have to face that challenge first before we change other things in the nutrition plan.
Yes. So a user writes, I tried to, but it's hard when I have bad habits. So
I know. And you probably heard about SMART goals. I talk to my patients about SMART
what
goals.
is it? Yeah.
So this is a technique to approach a goal. So you have to set up a goal, and it has to be broken down into small pieces, and try to address those things gradually, piece by piece. And then every week or every month to look back to see what you have achieved. And every single time when you achieve a goal, you should congratulate yourself. You should, be happy that you accomplished that goal. And you have to set up those things in time, kind of create a time frame. So you can say, this week, instead of eating or drinking, let's say, instead of drinking every day a can of soda, like, you know, we're not going to promote anything here, but a can of soda, instead of eating or drinking every week a can of soda, I'm going to drink just 3 days out of 7 days a can of soda, and the rest I'm going to supplement with water or mineral water or something else, or a flavored mineral water. But again, try to change that. And when you are at the end of the week and you look back, if you were able to achieve that goal, you were successful. And then the next week, you should propose yourself to drink just 2 cans of soda. And the next week, 1 can of soda and the rest water. So set up goals that you can make. You know, those goals are for you, not for everybody else. But try to give yourself that amount of time that you need. And then when you are there, when the time has lapsed, you should look back to see what you have achieved.
That's a great thing. And you can feel happy and love yourself. And that's the point about the stress reduction or mindfulness. So we have 2 goals and 1 approach.
Yes, you should be kind to yourself. I tell my patients that they should be kind to themselves. We as humans are the biggest critics of ourselves. So if we don't lower the standards, you know, others will not lower the standards for us. And we should be compassionate to ourselves, give, you know, time to ourselves, and enjoy the journey and enjoy certain things that you have achieved.
Yes. Set goals, be affirmative in making good choices. Yes. Yeah. Says our user. Yes. It's a good thing. And how about all skepticals about medication? Do you have a lot of them?
I have a lot
people
of
said, yes, I'm not for chemical things. I'm only for nature, and that. Yes, how can you communicate and give this anger or anxiety, fear away from this person? So do you have some recommendations for me?
I think there are multiple layers here. First, I think is the relationship that you build with the patient. When the patient trusts the physician, things become easier. That's one thing. The second thing that I see is happening all the time is all this negativity that is going on the social media, groups of support, people that are telling their bad experiences. And those people, you know, I understand that they have a rough time. I understand they didn't find the right communication channel with their doctor. I understand they go through a very stressful situation, but with their negativity, they will influence many other people. And when you go on those support groups, you are looking for support. You want to understand the risks, but also the benefits. And what I tell my patient is that every single person is unique. And what happened to other people is not necessarily going to happen to you. And if you have a communication that is very close, like I have with my patient, they are in contact with me all the time, you will find, you know, the answers that you are looking for. And if something bad happens, the doctor is there to help you go over that. And, you know, I always start with a lot of education, and I always tell patients these are the benefits, but there are also some risks. And like everything in life has benefits and risks. And we should always balance what are the benefits at this point in time compared to the risk that I have. And when you do the proper amount of education and you explain the benefits, and the patient is in a very bad situation, let's say we have a patient with rheumatoid arthritis that cannot move, cannot go to be with their friends, cannot be with their family. I had patients that couldn't pick up their kids from the floor because they were in so much pain. You have to understand that the benefit of taking that medication might be coming back to your life, coming back to things that you enjoy, coming back to be there, present for your family, travel if you want to travel. So medication was not invented to hurt people, was actually invented, and there is a lot of passionate people that work to bring up this knowledge up front to help others creating this medication. And yes, it's not for everybody, but many, many millions of people have benefited from medication. And if you think about last century or centuries ago, a lot of people were dying because of, complications from heart disease, from rheumatoid arthritis. A lot of people were disabled, in a matter of 10 years with rheumatoid arthritis. I don't know about you. Do you see that in Germany? Because I don't see that anymore here.
Not that much, yes. Our elderly colleagues, yes, they speak about this thing, but I didn't see it in real time. Very seldom.
I see the images of those crippled joints in the books, of rheumatology. I basically saw just a few patients that they had rheumatoid arthritis for 40 years, and they have not had access to this kind of medication. And when I start a patient with on a medication that is a biologic medication, I tell them about those things. I encourage my patients, because it's very important to give hope to the patients, to give, trust to the patients, because in this way, their mind controls everything else, and the positivity brings excellent results.
Yes. And what do you say to patients? They say, they are saying, yeah, biologicals are very new. I want to know what happens to me in 20 years' time. Yes, is that really new?
I tell them that here is the science. I did not invent the science. So I know patients are afraid of infections. I tell them from my experience, of course there is always a risk of infections, but if there is an infection that is happening, the patient will be in contact with me. We stop the medication, we treat the infection, and then we resume the medication when that case is. Of course, there are cases that, may have a severe infection, but there are also very good results with that, and many, many, many patients that will not have infections. And I encourage my patients these days, the patients that they feel good, they don't usually go on social media to tell how good I am on this medication.
Yes.
I feel great. So I encourage my patients that they feel good to go there and tell their story, because they don't feel the need to research more, and they don't feel the need to speak up because they feel good. They resume their life, they continue their life. But I feel like it's so much important for all the patients that are newly diagnosed to see both sides. The patients that they feel great, which are many, and also patients that they had an experience that might not be the good one.
Yes. It's also about trust, you said recently, yes. If you don't have a trust from your patient to your, yes, or our health system has sometimes very limited time per patient, and sometimes you have only a piece of paper as information for your new biologic or for methotrexate, and so I won't wonder if the patient said, no, this medication, I won't take it to me. Yes, because they do not have trust to this sheet of paper.
Yes, you have to talk to the patient. You have to share experiences of other patients. You have to tell them the science, tell them the benefits, and also tell them the risk, but always have that communication channel open to the patient. Because in this way, the patients will build up trust in us. Because we are humans like they. And
definitely.
And our relationship is it's based on, you know, what you transmit there, how you connect with others. And I believe that we as physicians, we have that opportunity to reach out more to the patients, to the next level. Not only take this medication and move on, I have 10 other patients waiting on the door. You just have to have the time. And that's what I do in my practice. I give a lot of time to patients. I keep the channel of communication open. I give them the paper too. If they want to review those things, they have the opportunity to review it later. But I always tell them, if you still have questions, come back to me, ask me. Don't do Dr. Google. Don't go on Dr. Google. Don't ask Dr. Google, does not have a medical degree. I tell them that. And they laugh about it. They laugh about Dr. Google, but this is true. Too many patients are going on the internet and they think what they find on Google, it is valuable information. And some it is, but it's a little piece from the knowledge that we have.
Yes, yes, of course. No? Yes, and amazing point is this issue we are just discussing, that is not the issue of our congresses, how to build trust to the patients. I never see this issue on our Congress, yes?
Yes, I think we should create a separate section for how to build trust with the patients. I think we should create a new topic to the American College of Rheumatology. We should propose that.
Yes. Oh, we have amazing words for our viewer. That's awesome. I truly wish I had a doctor like you. I love that confidence. That's what I want more than anything, is patient and honestly. Yes. What's great words. And I think, yes, it's very good finish now for our first talk, Diana.
Yes,
and
we should continue those.
Yes, it was the first time ever, yes, this transatlantic rheumatology talk to each other. Yes, great.
I think we break the ice here. We break the ice and we share that patients all over the world, they will experience the same, conflict and the same benefits,
I think,
of having physicians helping them, and, understand that physicians are here to help them. And that's what we choose this profession, okay? That's what I choose my profession, that I wanted to help and give to others care, consideration, compassion, and knowledge, but we come as a package. We really invest a lot of time away from our families to become what we are. And I think it's very important for patients to find or regain trust in physicians all over the world.
Yes, of course. And rheumatology is the best field of medicine to take this holistic approach and bring it to the patients. Yes.
Yes, I agree.
Yes. Thank you,
Diana.
Anna. Yes.
Thank you, Anna, for the invitation. I'm really, really happy that we did that.
Yes.
And thank you to everyone that joined.
Yes. Thank you, and bye.
Bye-bye.
See you next time.
See you next time.